AI now diagnoses patients, guides treatments, and shapes decisions that once belonged only to humans. As medicines transform, bioethics becomes the compass we rely on. What must society protect? What can it allow? And who should draw the line? Welcome to today's episode of the Green Wire, podcast by the Center for Environmental and Technology Ethics Prague. And our guest today is Dr. Geoffrey Dierckxsens from the Institute of Philosophy of the Czech Academy of Sciences. Welcome and thank you very much for being with us today.
Thank you for inviting me.
Geoffrey, to start very simply, what is bioethics? How would you explain it to someone who has never heard the term?
Well, bioethics, as the word suggests, is like ethics of bios, or of that which is living, so the organic. And generally speaking, I think there are like two main fields in bioethics. The first one is the ethics of biomedical science. Mm-hmm. So, for example, an organism in a laboratory. And the second one is the ethics of healthcare. And in both fields, the question is about ethics. So what is the right thing to do and what should we avoid? So in the biomedical science on the one hand and healthcare as a practice on the other hand.
Why should ordinary people care about bioethics?
Well, I think that bioethics is concerned with many aspects of our daily lives. We can think, for example, at difficult decisions such as end-of-life decisions. Mm-hmm. Everybody has relatives who pass away at one point. But also more simply, I think in terms of healthcare ethics, if you go to the doctor, for example, it's important that you do not only get good healthcare in the sense of like appropriate medical care, but that you also feel treated respectfully, that you feel that you are autonomous, which means that you are part of the process of care, so that you are not just a passive subject there, and these and other things. Maybe on a societal level, let's say, we can think of the pharma industry, that it is important that medicine is affordable for everybody. That's another example.
Can you give me more real cases you are dealing with?
Well, in my research center, we're mainly dealing with technology in healthcare. And that's also the topic of the project I'm leading at the moment. Maybe I can tell something more about that later. But an example is the use of artificial intelligence in healthcare, which, as you know, like artificial intelligence is used everywhere more and more and developed further and further. And that's also the case in healthcare. And one specific case or example, if you want, is the problem of like diagnosis through AI, because we're dealing with a black box here and we don't know how they come to the diagnosis, even though it may be good results, maybe if they're correct. So an ethical issue or a challenge is there, the loss of contact between healthcare providers and patients, and perhaps the risk of relying too much on AI.
And how can bioethics help here?
Bioethics can help, I think, first of all, in a theoretical way, which means that it can be a tool to reflect on the proper use, I would say, of AI in healthcare. And by this, I mean not in a medical way, but more in like when is it appropriate in terms of patient experience, for example. Does the patient feel more alienated in a healthcare system where there is a lot of AI? Or it could also be the other way around, that they gain more trust because there is a more objective diagnosis.
Could you tell me who are the main, let's say, stakeholders in bioethics? It's patients, families, doctors, hospitals, or governments? Who is it?
The healthcare providers, of course, and the patients are the main stakeholders, but then also other parties that may be involved, such as family and ultimately the whole society, because healthcare is there or should be there for everybody, of course. If you think of bioethics and biomedical research, then there is also the researcher as a stakeholder, but that is also counts for bioethics, but more specifically in the context of lab work, right?
You have already mentioned that AI somehow has raised new ethical challenges. Could you be more specific about it? What are the main challenges you are dealing with?
It's difficult to think of main challenges. I think there are many challenges of the use of AI in healthcare. But as I already said, one of the main challenges I see with it is the risk of patient autonomy, that the patient may have an experience of feeling more alienated in let's say, a hospital context where there's a lot of AI diagnosis. But also, and this relates to it, like the loss of the contact between healthcare provider and patient. This is important because healthcare is not just the fixing, let's say, of a health problem by providing medication or doing an operation, but it's also talking to the patient, because any diagnosis relates to how a patient feels. And so it's kind of solving a problem together to a certain extent.
And are patients already familiar with these risks, or do you think that they just don't have a clue now?
I think that there is little awareness, to be honest, among patients of this risk. But I am also don't want to speak in the name of the patients, and I don't really have numbers of this. But I think it would be beneficial, and therefore bioethics can play a role in raising awareness. On the other hand, or at the same time, should I say, I noticed that, but this is maybe also more a personal experience, that there is a demand among healthcare providers for guidance, because they feel that they maybe lose control is a strong word, but that it is a challenge to have more and more AI, let's say, for example, in a hospital environment.
Do you think that bioethics can keep up with the fast technological development, or it's always just catching up?
Yeah, that's a good question. I think that we have to keep up with the latest technology.
But it's quite hard, isn't it?
It is challenging, but I think that the nature of bioethics, let's say, is interdisciplinary. So the larger challenge, if you want, is to get up to speed also with some medical developments, even though you don't have a medical background, so which means reading medical papers or knowing something about sociology. That's another example, because sometimes it involves surveys with patients or some knowledge of law. So yeah, that's a larger challenge.
What worries people most today when it comes to medical technologies?
That's a good question, and I don't have a straightforward answer to that.
And maybe from your experience,
Mm-hmm.
or maybe your own worries.
My own worries are, I have many of them, I would say. But one example I could give you is privacy, definitely. I think this is a concern with technology in general. And what we see, if I can speak about technology in general, as a trend, is that in many instances, technology is being developed for the sake of technology without thinking about ethics, because when you ask the ethical questions, the technical experts may feel that as a slowing down of progress, right? Because you need to maybe slow down, reflect on how ethical is this technology we are developing. So that's definitely a concern.
So they are not willing to do that, right?
Mm-hmm. Yes, I don't see that in the big tech companies, but I see, for example, that European Commission finds it important that we think more ethically about technology, which is good, a good thing. So there are exceptions. Yeah.
You mean AI Act?
Yes, that's one example.
Geoffrey, what is principle-based bioethics and how does it differ from phenomenological bioethics?
Yeah, that's a good question. Historically speaking, bioethics does not exist in its current form that long. Like it only emerged after the Second World War and mainly in the 70s. And the first development was what they now still identify as principle-based bioethics. And basically it means that you develop certain key principles that are important for healthcare, and then based on those principles, you can make decisions in healthcare. For instance, is the importance of autonomy, so patient autonomy. Another example is to avoid harm of the patients in healthcare. And this is, of course, important, and it's a top-down approach, and phenomenological bioethics is more of a bottom-up approach, which focuses on mainly the relation between healthcare provider and patient, and tries to describe what is going on in this relation. Of course, this is different for every single contact, but try to deduce general concepts or principles from what is actually going on in healthcare, which then are identified as being important for healthcare.
So this is what makes phenomenological bioethics so special?
It is a bit of a niche, although it has been developed over the last 10, maybe 20 years, and it's becoming more significant. It is an unusual way of doing bioethics, but in my opinion, also a better way, because it looks at the healthcare practice itself before defining principles, whilst the principle-based comes up with concepts and then tries to imply them on the healthcare system.
Why is interdisciplinary so important in bioethics?
When you're dealing with the ethics of healthcare and healthcare systems, there are different stakeholders involved, or should I say different disciplines involved. There is, of course, medicine, because it's healthcare, but you're also dealing with ethics, which is a philosophical discipline. But another example is of a discipline that is involved is law, because you need a legal framework to make decisions in healthcare and also to make ethical decisions in healthcare. And those are just like three fields. There may be other fields like, for example, biology or chemistry, which are also part of a healthcare system. And then, of course, this is on a maybe micro level, if I can express myself like this, but also if we look at the healthcare system on a societal level, then there's also politics involved and policy making and these kind of disciplines.
And are these stakeholders willing to talk to each other to share their experience?
Yeah, that's a good question. It's a tricky question, but there is also not a straightforward answer. I think the answer is yes and no. It depends on, maybe straightforwardly speaking, on how interested certain people are in bioethics. For example, we work with healthcare providers that show a big interest in bioethics because it's their personal interest as well. On the level of politics, it's a bit harder maybe to reach out
it's
to
always
yes, yes.
with everything.
So it depends. Also in healthcare, I can imagine that there are many healthcare providers who have less interest because they just want to do their jobs well. But I believe that by doing their job well, they are implicitly already involved in bioethics, especially in healthcare, because if you want to provide good healthcare and make patients feel respected and comfortable and so on, then you are practicing bioethics basically.
You often use a term biopolitics. What does it mean and how does it relate to bioethics?
So whereas bioethics is about the ethics of organic life, let's say, biopolitics is about the politics of organic life. So it has to do, of course, that fields are intertwined with each other because they are close, but it has to do more about, the accent is more about policy making and how that can interfere, for example, with healthcare.
Could you describe the IRLaB projects you are now working on?
So with our research center, the IRLaB, the Interdisciplinary Research Lab for Bioethics, we are currently working on a Horizon project, which is funded by the European Commission, and we are part of which is called Pathfinder project. And we, as a team here based in the Czech Republic, we are part of a larger consortium of stakeholders. So these are other ethicists in the Netherlands, and then computer scientists in Finland, in Helsinki, Italy, and in Germany. So they're developing a technology which is based on radio frequency, and it's using, basically, to put it very simple, radio waves to measure certain things. So as a video camera would make images of movement, it uses radio frequency to measure movement, which means that it is much more private because you don't see images, you just have data from the radio frequency. And we are testing this technology in the Czech Republic in the context of palliative care. So what we do concretely is to install, with the patient's permission, in their home situation and run the device, which is a radio frequency technology, for about 10 to 14 days, collect the data, and then we sit together with, then we do a qualitative interview with the patient about how they have experienced the presence of that technology, if they feel not so much at ease, or they feel better, they feel more autonomous or less autonomous. And then we sit together with the whole team, which is a doctor in palliative care, some philosophers, a sociologist, and a legal expert, to analyze what we can learn from it about the ethics of this specific technology, which values can we identify that will be important for the future development of the technology. And to give you a concrete example that is also a little bit funny, maybe one of the values we came up very soon is that the way it looks is very important for patients to feel comfortable with it, because it is not a developed product. First, it was an open radar with a light that was flashing constantly. So we had to make a casing to make it more look safer. So aesthetics and ethics sometimes interfere.
Okay. And maybe could you describe a little bit more how this technology can improve comfort of these patients?
Of course. It's a good question. And maybe it's important to stress that we are at the very early phase of development of this technology. So what we measure right now is just movement of patients. This is not used for medical purposes. We do not use that. We want to just have a sense of the patient experience having a device like that in their homes. But the if the technology will get developed further, it has potential medical uses because the radio frequency is quite detailed. I am not myself an engineer, but the engineers tell me it has the potential to measure something like heart rate or breathing patterns. And that you can imagine that could have a great potential to have a monitoring device that keeps an eye on these parameters at home, especially with very ill or elderly people, if they choose to have it, of course.
And it's hard to pursue patients to be involved in your research? Do they want to be?
It's hard.
It's hard?
Yes, it is. But
So how do you pursue them?
So the patients are recruited by Adam, the medical doctor in palliative care. It's his patient base. He knows them usually very well. We have a small financial compensation, of course, which is usual for participation in scientific research. So that helps. But of course, it's a challenge because it's palliative care. So these patients are seriously ill at the end of their life, usually. But some of them, to give you something concrete, express an interest in technology, and they feel that contributing something to science is valuable for them. So yeah, it is hard but not impossible.
And how many patients are involved in your research?
At the moment, we have been testing in the homes of 11 patients, and we plan to do 4 more, so that the test group is of 15 patients in total for this specific project.
From your research to more general question, how do culture differences shape ethical decisions in medicine?
I think it does it in many ways, and sometimes in obvious ways and sometimes in less obvious ways. But to give the example of how the pandemic was managed in the healthcare systems and in the governments, you can see, for example, ideological differences between different countries and what kind of rules, how they implement them. Maybe an extreme example is China, in which the freedom of the citizens are less valued, so it is easier to go quickly to extreme lockdowns, while in countries in Europe this is harder. So that is one example. But we have also seen examples of discrimination of cultural minorities, for example, Black people in the United States during the pandemic, or more in Central Europe, Roma people or Roma communities. So that is another example.
And women sometimes.
Of course, yes. And vulnerable people. And so that's another example. But also, I think that in the general mindset of certain medical procedures is culturally influenced. For example, religion can make that certain medical procedures are viewed as more taboo or less straightforward.
And also ideology, like people who are trying to change their gender, let's say. Geoffrey, is there a bioethical issue today that you find especially urgent or under-discussed?
I mentioned the use of AI in healthcare. I think that is very important. But you also mentioned the question of transgender health, which I think is also a very urgent question, because what we see is that transgender persons struggle in our societies by getting their identity accepted, and sometimes they are in need of healthcare to affirm their identity. There are in many countries good healthcare systems for that, but there is also they often struggle because the healthcare systems are often still very binary in how they provide medicine. So I think that is a big challenge as well.
And how can we make stakeholders or those who are responsible to care more about these topics, to be more involved?
I think that in the healthcare context, the stakeholders do care about it. Don't get me wrong. I think that the people who work in transgender health, that they are very devoted. But I think what is especially required is maybe more bioethical research about how can we improve the relation between healthcare provider and patients for transgender health, for example, by looking at what is the experience of trans people in those healthcare systems, what is the experience of the providers in those systems.
And how do you see the future of bioethics?
That's a good question. I hope also that bioethics will become more and more important in the future, but I feel that it will be, especially if we see that healthcare becomes more and more complex because of the development of technology. More things become possible maybe in the future, not just in the traditional sense of healthcare, but also in what they call enhancement, like making people better, stronger, and so on through healthcare. So I think there will be only more challenges for bioethics and healthcare ethics in the future.
What new dilemmas might appear in the next 10 or 20 years, according to you?
It's difficult to predict that specifically, but again, the challenges of technology may come with new dilemmas. For instance, the role of the healthcare provider, the contact with patients, how AI will mediate in that. The dilemma there is like using more AI may not only speed up the healthcare process, make it more efficient, but also improve it because it can make the diagnosis better, so
and
to
faster.
speak, and faster, and so more healthcare may be provided. But on the other hand, the challenge is that something gets lost, especially the human contact.
The human contact. And what we can do about it?
We should be aware that it is happening.
And it's happening now?
I think so.
Yeah, could you be more specific about that?
I've seen, for example, a concrete example of a hospital in Antwerp in Belgium, where I am from, where an entire staff of cardiologists was fired because they were relying to a large extent on AI and they were not checking the diagnoses as they should have checked
Really?
them. Yes.
Geoffrey, if you could give one piece of advice to the public about medical ethics, what would it be?
That's a difficult question. But I would say that people should not be afraid of healthcare ethics. I think that you should not look at it as some moral police in the hospital or something like that. I think that we just try to describe and open the dialogue between the different stakeholders and ultimately, hopefully, make it better also for the patients and for the doctors and the healthcare providers.
Hopefully, it will happen in the future.
Hopefully.
Thank you very much, Geoffrey, for your time and for such an interesting discussion with you. Thank you.
You're welcome.